A surprise medical fee that shouldn't be a surprise. It's called a facility fee, a separate charge just for walking through the door. Wake News investigative reporter Lauren Sweeney has tonight's cost of care investigation.
Take a look at these signs. Look closely. It says Outpatient Department of Lee Memorial Hospital. But you need to look out for a sign like this everywhere, not just at a Lee Health facility. If you see a sign like this posted on the door of any doctor's office, buyer beware. You could be on the hook for more than just the cost of your visit with the doctor.
You don't have big fees.
Jan Trefzer is on a one-woman mission.
I feel like I'm the Aaron Brockovich of outpatient facility fees when it comes to Lee Health. Because I'll tell you what, I've got people looking.
When she went to the Sanctuary, an outpatient facility of Lee Health, to see a doctor about back pain, she expected to pay $45, her copay to see a specialist.
This doctor, both times, never even laid a hand on me.
To add insult to injury, those appointments cost a lot more than $45. Lee Health billed for $1,000 worth of facility fees, and Jan was on the hook for $550 of them. And then she says the same thing happened to her sister-in-law, who has special needs, at a totally different Lee Health facility.
How important is it that you see a cardiologist?
Because I had a heart attack and they have to watch it.
Virginia Bogue says she really liked the cardiologist she was seeing at the Lee Physician Group practice off of Bass Road.
We were forced to find an alternate physician.
But Trefzer, who's Bogue's power of attorney, says the facility fee to see that doctor increased the cost from $40 to $120.
She's on a limited income, and we chose her Medicare insurance based on known copays, known deductibles, known expenses.
The one woman I'm featuring, she now says that she's outpriced from her cardiologist. Is that fair that she's outpriced because of a facility charge? She can't see her cardiologist now.
So we find that our charges are, we try to base them on being at the 50th percentile. So some medical practices are going to be higher than this, and some are going to be lower.
Mary Briggs is the head of strategic communications and public relations for Lee Health. She says Lee Health charges facility fees at outpatient centers because they have the same regulations as a hospital, which costs more to run. So by law, hospital systems can recoup those costs by charging patients the fees.
That's what they will say. What I will say is, if you're running a clinic in a strip mall, right, just an example, that's 10 miles from the hospital, what are you really, what are the real additional costs because it's got the hospital system's name on there?
John Hess is a healthcare billing advocate. He says more and more hospital groups across the country now own physicians' practices, and patients are getting facility fees for everything from physical therapy to mental health care.
How big of a problem is this for people's pocketbooks?
It's pretty big and it's growing.
We completely understand how frustrating the billing system is in healthcare today. And we agree it's broken, and there is work being done to fix that, to make it more transparent, and we want to be part of that solution.
Lee Health provides paperwork at check-in that explains that you will be billed for the physician and the facility, and by law has to post signs alerting patients that they are entering an outpatient facility. But Hess says none of it actually tells people what they can expect to pay.
If you see that sign, that should automatically be like a red flag. I'm getting 2 bills.
Let the consumer know so that it can be buyer beware, and let the person understand what they're doing by walking into that office.
And now we do. That woman that you mentioned in the story said she had to get a different doctor. Did that facility charge come on her bill when she did that?
No. Well, both Jan and her sister-in-law, they're seeing a different doctor, not affiliated with outpatient facilities, and now they're just paying their known co-pays. And Hess says that's really his best advice. Avoid those outpatient facilities if you can. But around here, sometimes you can't. There's a lot of specialists that will only see patients that are affiliated with a hospital. So if you get one, dispute the charge.
And you can look for that sign on the door ahead of time and ask up front so you're not surprised.
Yes, and call your insurance company and find out how much they're going to cover, and try to ask ahead of time if anybody can work with you on the charge.
All right, Lauren, thank you.
Covering the Capitol, and the state Senate wants to put an end to surprise